But I want to reiterate some of what my colleague from Massachusetts talked about earlier. It is a deep concern for me. I represent the state of Maine, and I'm proud to represent many active duty members and their families as well as military retirees and their families. I have over 34,000 military families and retirees that are fortunate to have access to outstanding health care provided by U.S. Family Health Plan at Martins Point Healthcare in Maine. I visited their facility. I've seen their use of the medical home model of care. The beneficiaries tell me how much they like this health care option. I mean, it's been said many times, this is exactly where we want to go with health care with our military retirees, and they are very happy, very satisfied about it. In March, I sent a letter to you stating my unequivocal support of how this program currently works and suggesting that I would oppose any changes that would negatively impact the ability of them to provide care to beneficiaries, including those age 65 and over who have earned their health benefits through their service to our nation. I'm sorry to say, General Stanley, and with all due respect, I wasn't completely pleased with your response, and now the FY12 President's budget request includes a proposed legislative provision that future enrollees would not remain on the plan upon reaching age 65. I'm concerned about this proposal, that it would eliminate access for those in greatest need of care and their ability to receive what's the highest rated health care plan in the military. Let me just shorten up some of my conversation here, because I know you know exactly what my concerns are and what I'm talking about. But I want to reiterate that I'm sure you know by law the government cannot pay more for the care of a U.S. Family Health Care Plan enrollee than it would if that beneficiary were receiving care from another government program. So I have a hard time seeing this as anything but a cost shift over to Medicare while destabilizing what is already a very successful program. So I guess I'd like to hear you address that, and also address my concerns that the destabilization of this program, in my opinion, isn't consistent with DOD's stated priorities of improved health management and the continuity of care. I'm just not pleased about what we're doing here in the budget. I understand the importance of cost efficiencies, but to me, I guess it's a little smoke and mirrors and maybe not going to be good for the long-term health care of the people in my state.
Thank you for the question, Congresswoman Pingree. I think as we look at what we're proposing, that each hospital that we're working with, particularly with the Family Health Plan, that we're going to be working very closely with them, because the changes, first of all, may be minimal in some cases, or almost barely perceptible initially as we look at how the Medicare, the funding is worked out, because you really don't want to just unplug and move right into something that becomes a cost shift. At the same time, we're trying to address something that had not been addressed for a number of years in terms of how we, work with the costs and everything. So bottom line is we're going to work with them. And I hear your concern, recognize the concern, and we're going to do our very best to work with them. I'll ask Dr. Woodson to address this also.
Thank you very much for that very important question. I think the issues that we need to remind ourselves of is that this is not about taking a beneficiary away from their doctor. They can continue to see the doctor. They can continue to go to the same hospitals. But we pay about $16,000 per member per year in capitated fees to the Uniformed Services Family Health Plans, and it's important to note that they're plans. It's not just about hospital fees, but it's about the money that's also paid to their primary care physicians. Whereas the cost to the government for, let's say, TRICARE Prime is about $4,500, and for TRICARE Standard is about $3,500. Just good business practice in this day and age would suggest that we have to get better value for the dollar. Now, I want to say up front that we consider all of the facilities and providers that are in the Uniformed Services Family Health Plan as great partners. We don't want to lose them. I just think that in these tough times of budget constraints and rising health care costs, we look at contracts everywhere and say, how can we get the best value? The proposal actually will save the entire Federal Government about about $300 million over about 10 years, because right now, of course, we pay about 42% higher in costs than we would pay under Medicare fees. I remind you also that most of the individuals that are Medicare eligible actually have taken already on Part B. 90% or so already have Part B, because if they were to move or circumstances in their life cause them to shift to other doctors, if they don't take it on at age 65, they pay severe penalties. So the impact to any individual patient is likely to be not that dramatic as well. So it's about being good stewards of public money. It's about preserving money for the future and making sure that the military health system and the provisions under TRICARE remain strong in the future for those who might serve in the future, and bringing equity, if you will, to the benefits for all Medicare-eligible beneficiaries, as well as equity in terms of how we pay all of our providers and hospitals that may serve our men and women who have served. So there are multiple reasons to really consider this, and I think, again, it's one of those modest changes that, on balance, says that we've looked at a number of initiatives to produce efficiencies.
My time's up, but thank you. I'm sure
And Ms. Pingree, we will get back to another question, too, so thank you so much. Very good question.